Hello, good evening, friends. A 45-year-old woman was brought to me by her husband with only one complaint. The complaint was that this lady used to spend about 2 truckloads of water every day for her bath. 2 truckloads of water and about 20 Rexona soaps every day for her bath. Little time did I take to make a diagnostic formulation of what's called as an obsessive compulsive disorder. This lady was very, very intelligent, quite educated. She was an MA in economics. The husband was well placed, no traumatic factor whatsoever at all. Her memory was intact, her orientation was intact. There was no past history of any head injury. In this disorder, what is called as an obsessive compulsive disorder, the patients are aware that they are getting repeated thoughts. They want to control the thoughts. They want to exert full control on their thoughts. But God forbid, they can't exert any control at all. They have no control on their thoughts whatsoever at all. These thoughts can be of two types. One, an extremely religious thought. Other, very highly sexual thoughts. This lady had severe religious thoughts. When I asked her why do indulge in this sort of a behavioral pattern, back came the reply, Sir, I belong to Madhva philosophy. We give a lot of importance to what is called as purity of mind, purity of body. In Kannada, madi madi anta ಹೇಳ್ತೇವಲ್ಲ. So, to observe that, I need to take repeated bath. This taking bath initially was confined to only about 1 bucket or 2 buckets of water. As the stress mounted, as her tensions increased, the amount of water that she used to spend in the bathroom also increased. Ultimately, 2 truckloads of water every day she used to spend for her bath. Not only that, along with that, she had intense anxiety. She had palpitations. She had depression. She had suicidal ideations also. Obsessive compulsive disorder can lead to all these catastrophic consequences also. We have an entity what's called as obsessive compulsive psychosis. Some people do recognize it, though of course scientifically many psychiatrists do not agree to this sort of a terminology. OCD can result in psychotic features also. We have different types of personalities. An obsessive personality is welcome. What do you mean by an obsessive personality? He is a person who is perfectionistic, who is a stickler to discipline, is punctual, gives importance to time sense, then highly systematic, highly disciplined, and these are the persons who are highly conscientious in nature. They can't commit any mistakes at all. They can't indulge in any sort of committing mistakes or blunders, etc. They are conscientious in nature. They always try to go on a national highway. They do not resort to shortcuts or short paths, etc. Some physical disorders can also produce an OCD. For example, a neurological disturbance called as Huntington's chorea that also can present to a neurologist with only after the symptoms. Stress can trigger off OCD symptomatology. Here we have 4 types of personalities: thinkers, avoiders, repeaters, checkers. Thinkers, they keep on indulging in repeated thinking. Avoiders, they avoid certain things. Repeaters, they keep on repeating the same things. For example, some people keep on reading the numbers on the cars in a reverse way or in a systematic way. They keep on remembering that also. Thinkers, avoiders, repeaters, checkers. Checkers you are familiar with. Some people keep on checking the bolts. They keep on checking the locks of the door, etc. This is a disorder which is extremely common nowadays. Initially, about 40 years ago, when we are doing post-graduation, we were taught that OCD is a disorder. Nay, not so anymore now. Then, lot of problems were there about 40 years ago to procure medications. I vividly remember that we used to get one tablet called as tablet anafrenil, trade name. This used to be available only at Royal Chemist in Bombay and at Cash Pharmacy in Bangalore. Now things have changed. Thanks to liberalization, all these medications, very good therapeutically effective medications are available in the vicinity of all of us. OCD is a very easily treatable disorder, but never ever neglect it, lest it leads to severe depression and sometimes it leads to suicidal ideations also. So the main symptomatology of this disorder is thoughts and thoughts, excessive thoughts. Patients cannot control their thoughts at all. They want to control. They are brilliant enough. They have a cognizance. They understand that these thoughts are repetitive in nature. Like a cassette, it keeps on playing repeatedly. They want to control it, but they can't. The psychiatrists are the best physicians who can help to undo this sort of a disorder. Please do consult your psychiatrist if any persons in the friends groups or amongst relatives have this sort of problems. Remember, it can be treated very easily. And one more treatment, ketamine therapy, is very, very useful for treating obsessive disorders also. We should have an obsessive personality. They are big achievers in life. But obsessive compulsive disorder, that can be detrimental, that can be handicap. Thanks a lot for watching the video. Please do share the video, subscribe to my channel. All the best. God bless you. Thank you.